video portion. There's a lot of load going in, a lot of people using Zoom. So if you don't have to use, we like seeing everybody, but if you can put it on a non-video stance, it apparently helps with, some of the bandwidth, but feel free to keep it open. So I want to welcome everyone. My name is Barbara Sullivan. I'm the Executive Director of Village to Village Network. And we wanted to do this today to kind of give you an open forum. I have a little bit of a structure and some things to share and go through. And then between Travis and I, we're going to take questions. You'll see Travis sent you out a notice through the chat room, good morning, hello everyone. We're going to use this to have conversation and questions and truly find out some of the things that you are providing, some of your, things you need, maybe something you can share, best practices that's working for your village, and we'll be able to get through this. So without further ado, I'm going to share my screen. And hopefully everybody can see this. So today's update from the CDC, I wanted to go through and show you, hang on one second, some of the live updates with the CDC today. No, that's not it. Hang on. Oh, it's not there. I apologize. So if you go to the CDC coronavirus, today's updates are on the CDC. I'm sure everybody has exhausted their ability or listened to the news exhaustively. I mean, it's never ending. And today's news is not new news, but it does give total updates. One of the things that we're constantly hearing is with states that are asking people to stay at home. And the newest one is the state of Maryland, who's been told to stay at home. That makes, I believe, 9 states, particularly those are on the Northeast and the Mid-Atlantic, that have gone to this, to do this. So check out the CDC. I'm not going to go into full detail. Food supplies. We have, we've heard several things. Travis posted on our Facebook an article by the USA Today about the backlog of deliveries, but keep on trying. If it's something that you would like, Travis and I thought we'd do a Zoom video on how to, register with Peapod or Harris Teeter. I just got an email today, about 20 minutes ago, that said that Harris Teeter is dedicating Thursdays to senior-only pickups. So if you have volunteers that are still willing to pick up groceries, they're dedicating that. They're waiving the fees for them to get the groceries in their store. And so that's an avenue of those that have Harris Teeter near them. Instacart, Amazon, again, they're all backlogged with some of their groceries, but it's good to just keep in mind that this will open up, and a lot of grocery stores are advising that they are offering early hours for seniors only. So again, if you have volunteers that are willing to do errands, or if your senior is able to drive and get there, they're really dedicating these hours. And I apparently, I was at the grocery store yesterday, Sunday, and they're limiting, we had an abundance of groceries. I'm at the Jersey Shore. And but they were limiting packages. They were limiting one package of chicken, one package of hamburger meat. So just keep in mind that they're trying to cut down on the hoarding issues that we've seen in the past. And every indication is that there'll be an abundance of toilet paper. They restock all the time. I heard commercials, and I'm in the Philadelphia area, where they're hiring at Walmart and some of the grocery stores, and in need of people who have been laid off. Walmart's issuing 150,000 jobs that they're looking for. So keep in mind, I think that we will be restocked and there will be accessibility to food and resources. CVS was going to join us on this call. Unfortunately, they're a little backlogged. We have a nice relationship with Omnicare, and they are actually going to be a sponsor at our conference in October. And I believe we are having a dedicated webinar in the next week or so with Omnicare and CVS. So stay tuned for that. And I look forward to that. But what they did was waive all the fees for delivery and prescription drugs. So if you have a CVS near you, and I'm sure that Walgreens and, are going to follow suit. So keep in mind, again, look at your local news. Use for technology, everybody, FaceTime support with Apple is your FaceTime if anybody's, got an Apple. Skype, Zoom. A big shout out to California Village Movement, who did a great tutorial. If you have not seen it, this is the YouTube link, and we will share that. We already shared it with some of our social sharing, but Travis and I are putting out a newsletter by the end of the week, and you will have that on there. So thank you, California Village Movement, for doing that for us. Another one is TechSoup. Check out their response for nonprofits. Again, we'll send this link out to everyone as soon as possible. Phone trees. This is something, and I'll toot my own horn. We did this back at my old village at Mount Vernon at home when we had the Dureco, and it worked. And whether you get a group of volunteers to do the calling or you have your board members, it's a great way to organize a calling tree, just to have somebody, call and, check on, each other. It's a touch, and a touch is just a reach out. And I got to tell you, I participated in Mount Vernon at Home's calling tree last week, and members were so appreciative. Some of them did need some groceries, and so they were able to, facilitate, but also talk to them and say, would you like a call every day? So we've put in here how to do a call tree, and I'm not going to get into the weeds with it, but want you to know that we will be sending, again, this link in our newsletter, but also there's several documents in our document library, and Travis, you'll have to remind me who did one that they did an example. It was really great. So just check
Wider Horizons.
Wider Horizons. Thank you. They so it's in our document library under our resource tab. So definitely look into that. We were all worried about social isolation before this happened. So again, looking into areas where if a member has a computer and the village can do it. Some villages are doing it, and we're going to hear from a lot of folks. But all the Broadway shows have been downloaded. They're doing it online. I actually watched the Jersey Boys the other night, so I was excited. The virtual museum tours, these are always good. But then using, and then also check out encore.org. They have some great facts, and they had a great webinar last week for people interested to connect with their community. But we all worry about our villages. And so using like the technology, the Zoom technology, to still have your book clubs, if you can get your members to, have a happy hour, social hour. One of my siblings had a happy hour, social hour last night and invited me. So I saw all my family and we all caught up, and the grandkids were all running around, and it was crazy, but it was kind of reassuring. So it is that touch that everybody can see. I also want to remind you that our network providers are out there to help. A lot of villages have had an abundance of new volunteers that want to help. And even though if they're not transporting people, they still want to do the background checks and whatnot. So I don't know if Choice Screening is on today or Sterling, but it's a great opportunity to check out their provider. We are going to be having a webinar with Choice Screening in the next week or so. So we're looking forward to that. Some of the home health care companies, because they are employees that are necessary, they're getting around some of the guidelines as far as the stay at home and being able to help our members at home. So reach out to your local home health providers. And also our two software providers that we work with, Helpful Village and Run My Village, both have had webinars and with their products and helping to do like the online phone trees. So check those out and see if it's worthwhile to you. Not everybody has these programs in place, so it's really good to check out what you have, but also utilize the resources that you have available. So it looks like we have a ton of questions. So we're going to go through some of them and see if we can, answer some of them. In Maryland, the governor's order today is to close non-essential businesses. It's not a shelter-in-place order. No, it's not. And that's from Douglas. And the shelter-in-place is different. Up here in New Jersey, the order is to stay at home. And it's a little different than the shelter-in-place. We in upstate New Jersey have had a incredible, because of the New York infections and everything. They have a higher percentage. Here in South Jersey, not so much, but the whole state is stay at home, which means you can go to the grocery store, you can go to, and businesses are required to close if they're not essential. So non-essential, and if you want a list, I can provide a list for you, but things like essential businesses are grocery stores, gas stations, banks, hardware stores, medical, places, Target and Walgreens and Walmart are open because they do food and essential things. Non-essential, hair salons, regular businesses, realtors, car dealerships are non-essential, although the service departments have to remain open. So there's a wide varying things, and you just need to check your state to see what is essential and not essential in your state, because they do outline that. Someone suggested Walgreens.com. I'm sorry if I didn't mention that. Kroger stores, yes, is also taking other online orders. Here in South Jersey, we're very limited. We have Acme and ShopRite, but both of them have online order capability. So you really need to check out what your local community has as far as groceries. Even the mom and pop, grocery stores are open. So it's important to check out what you have. So Margaret said that they're seeing notices from Walmart that they have reached capacity and will not take any online orders until Wednesday, which is sad, and I have seen it a couple times, but get your order in. Like I said, Walmart's also asking for some of the people that have been laid off to come and work. And so they're really trying to ramp it up a little bit more. Tony said in California, many stores, including Costco, have gone to senior hours only, 7 to 8 a.m. And again, if your senior can't get out there, and that's a lot of the grocery stores, which is great. They're dedicating this to the most vulnerable populations. And that's, I think, throughout the country, you're seeing that. Here's my face. Sorry, Queen Anne's and here's my face. Here, I'll take my glasses off. They couldn't see me, but here I am. um, and as far as the little info sheet that I have, we're going to distribute it through our website and through our materials and newsletters, so you all will get that. I'm also going to distribute the Encore publication or resource that they just sent out a little while ago, which I thought was a great resource. Let's see what else. Jane also said ordering online for delivery and pickup is changing by the minute. Same as the senior shopping hours. I think, because, people are choosing not to put it on the website, I think we still need to look at it as an avenue and try to help our volunteers, because they're still looking for things to do. And they are, if you have a stay-at-home order, if they're doing something for a senior, then they're essential people to be out and going. A lot of folks around here are wearing gloves, and we suggest people, if you don't have gloves, to wear your wool gloves and then take them home and wash them, and, a lot of people are asking, and I've seen it. I was at the store and some lady in front of me we had somebody between us at the grocery store, and she turned around to the lady and she said, "You're not 6 feet away from me. You need to back up." So people are really adhering to that separation and the guidelines that are recommended. What is the risk? Marcia said, what is the risk for highly vulnerable seniors congregating in a store during senior hours? Does that expose them to more risk? I'm not a medical person, but somebody who is highly vulnerable should be getting somebody to help them grocery shop, whether it's family or a friend, or if they're part of the village. The people who are higher risk are the ones that have underlying, conditions, that they are immunocompromised, and they need to make sure, be prudent. And, that's our job as villagers, is to be prudent and to give them the information and say, you need to stay home. I have a volunteer, give me a list and we'll go grocery shopping for you. Online is we know, we're seeing all the chatter. Online is not working successfully right now, but that doesn't mean it's not going to gear up and ramp up again. We've had some issues around the country with hoarding, and that's why we're out of stock with a lot of things. And instead of going in and just, getting a roll of toilet paper, they're getting 10 rolls of toilet paper. And my understanding, listening to the news and everything else, we have the supplies in the country. It's just that the demand is exceeding it. So grocery stores are restocking, and we're hearing, success stories of people. Oh, I was able to go and get a roll of toilet paper, or a roll of 6. So I think we have to be patient, and that's sometimes not easy. But Marcia, to answer your question, yes, it does put them at more risk. And the answer is that we need to offer them alternatives to, going out in public. Paul Sobel said, stopping at Trader Joe's this morning, I noticed they were restricting patrons, just a few in the store at a time. So there was an apparent 15-20-minute wait. I think that's a smart idea, especially if it's like the Harris Teeters down in Alexandria. If anybody's online here, that place is insane on a good day, without the coronavirus. And so, making sure that you stand in line outside, or you're in your car and you get ticket numbers or whatever. These grocery stores are looking at how to best facilitate, grocery shopping and getting our seniors in. Jim Ludden says that Talos Elders is starting a daily check-in with volunteers, calling our members daily to learn the needs and provide social contact. Jim, that's awesome, and that's exactly what Mount Vernon Home's doing. And those of you that have a picture, raise your hand and show me if you are having a program, if you have any kind of call system. See, and that's enlightening, because, we're all in the same boat. It's not just our seniors, we're all homebound. I mean, we're all, at this point, been told if you don't have a stay-at-home order, you're still supposed to, not being social, events, and a lot of, restaurants have closed. I know, um, being where we are, if you can imagine, all the casinos are closed. That's 46,000 employees that we're told to go home. It's an incredible volume and drain on our economy. And so not just our seniors, it's just everyone. The kids that have to come home because of daycare, we've got to find a good solution where our seniors can reach out to maybe, some of the younger generation. I'm interested on Encore's call on Wednesday. You can go on their website. They're going to have something to see how we can do intergenerational social interaction with some of our younger folks. And that might be a way for our seniors to get involved, whether it's that old school writing a pen pal, or, calling up or having a virtual, I don't know if y'all play this, but I play Words with Friends every morning, just having a little interactive Scrabble game with a younger person. So there's ways that we can get around doing this. Shanna, hi Shanna. Talking locally about having a webinar or web conferencing on how to video chat, video conference, and perhaps most importantly, how to do a virtual clinician visit. It's a really good idea. We have done some video chats. I know that a lot of physicians are doing telehealth at this point, and I'm sure that clinicians are facing the same thing. I know that Mount Vernon at Home, and this is something you all need to look at. They stopped doing volunteer transportation services because they called their insurance company and they said there's nothing written in their umbrella policy in the case of a emergency or a natural disaster like a pandemic that would cover us with a volunteer taking a member. And so you really have to call your insurance agent, see whether or not, if you're still doing transportation requests, if it's, something that's covered, if the volunteer got sick or the member got sick or both of them got sick, how liable is the village? And that's a really serious question that I can't answer that because we have 50 states and 50, different structures as far as insurance and liability insurance. So it's up to you all to call your own insurance agents and find out the extent of if you're still doing transportation requests, if you should continue. How are people helping members who are isolated and need groceries for medications? Okay, wait a second. We're gonna get back to that, Amherst. How are people managing the privacy issues around Zoom for member meetings? Well, I'm gonna open it up to Amherst in a minute, but let's answer Mill City Commons as far as the privacy issues for member meetings. There's not, unless I'm wrong, there's not a lot of privacy issues. If you're doing a Zoom conference call, it's to be socially connected, and typically it's not to talk about, personal or health-related HIPAA type of, conversations. It's more of trying to connect your members socially by having, your affinity groups to connect, or, a happy hour or a coffee social, or however you want to set up your Zoom conference call. I'm going to open it up and, I'm trying to figure out how, Travis, do you know how to do raise your hand? Oh, I do. If you click on your mouse on participants, you'll see a bar come up on the right-hand side. It'll say raise hand. If you want to raise your hand and maybe answer some of these questions or have something to say, we'd love to hear from you. Everybody see where I'm mentioning? So if you click on the participant tab, you'll see a screen come up and you can find the participant. And under my name, I can say, raise my hand, and you see my hand raised. Do you see that? And then you can lower your hand. So Patty just raised her hand. And Patty, if you want to go on unmute, you can ask a question or talk to us. Or not. Anybody else on here?
Patty doesn't have a microphone.
Okay, all right. Well, if you do have a question, okay, Shanna, go ahead and unmute yourself.
I did already, and I just wanted to chime back in on the idea of figuring out how to help people just navigate virtual meetings. I think somebody in the thread said, you know, part of the problem is technology comfort and savvy. And so just doing things across the board that are going to help people get more comfortable with it, or even get some help with it, you know, practicing video chats with the volunteers. So then, or practice, and Carrie reached out to say they're doing something, you know, she's helping people with Zoom, and you mentioned that as well, you know. So anything we can do for members, not just in any one village, but in all villages, you know, either at the V2V level or at the regional levels, you know, or locally, talking to Montgomery County and the like, you know, I think will be huge in just helping people stay connected and realize they have other ways to get connected. But most importantly, if they're not feeling well, but they're not having, you know, they're not contracting the coronavirus, they need ways to be able to engage with their providers. And right now they're basically just pushing everyone to telehealth. So it's like just helping people understand that and then helping them navigate it, I think would be a huge help across the board. That's where I was going with that. Just
Thank you, Shanna. Thank you. Betsy, you had a question. Unmute yourself. There you go. You have a question? I see you're unmuted. Okay.
I unmuted her, but maybe her mic's not working.
Okay. Village in the Heights.
Yeah, I have a problem with Zoom. I'm trying to use it, but it seems like it shuts off after 40 minutes. How do we extend the time on Zoom?
Okay,
That's
so here's
for the free version. If you have the free version, you're limited to 40 minutes. If you pay for the lowest level, I think it's pretty much unlimited.
Okay.
But you are limited to the number of people, so you're limited to 100 people. And then price
on which version?
On the lowest level paid version, you're limited to 100 people, and
Good.
it goes up from there.
Thank you.
And I believe it's, if I'm wrong, correct me, but I think it's like $14 a month.
Yeah, that's what I signed up for.
Oh, so you should have an hour.
Okay, good. Thank you.
All right.
You can go more than an hour. You could go hours, as far as I understand. You can go a couple. We've had Zoom meetings that were well over an hour before.
Yeah.
Okay, thank you very much.
So Dorothy.
Hi, I'm from the Chicago Hyde Park Village. I read a Wall Street Journal article about some groups. I think it was an international article, so I'm not sure, no groups specifically were mentioned, are preparing sort of simple devices like iPads to give to seniors. Has anybody been doing that, where you could prepare something so that some of these most typical things could just be handed over to someone, and with very little explanation of, you know, how to use it? Because some devices can be pretty simple if you had just a few things on them, like Zoom and perhaps something else. I just want to know if anybody else has been doing, or if anybody's doing this. It was just an article in the paper that I read.
Not that I know of, but it would entail one, or it's a cost issue. So who's going to incur the cost of an iPad whether or not these folks have internet in their home. It's a multi-layered, complex problem, and one that, you know, there's no easy answer, unfortunately. It's a good question. I just don't know of anybody. If anybody knows of anything, unmute your mic and let us know. Yeah, I don't think so. I think that's, you know, technology in the next stages, you know.
The people and everything's under control, and it clearly was not.
So, Abby, did you have a question?
I didn't have a question. I was going to say that we were told, I'm in the Washington, D.C. area, and we were told that TechSoup provides Zoom for a cost of about $65 a year instead of $300 once you register as a nonprofit.
That's awesome. I mean, we just did the link also. That's one of the resources we put on our little page. If you haven't already signed up for TechSoup, which a lot of nonprofits and a lot of villages, when they start out, are actually guided to do that. And it's a great idea to, you know, because you can get like QuickBooks and, you know, Microsoft Word and some of the, you know, software, back office stuff that you need to run your village pretty, you know, inexpensively. So that would be great if they made a deal with, you know, Zoom. So check out that website. Thank you. Amherst, I said we were going to get back to you.
Oh, thank you. Yes, we're in a new startup village. It isn't quite we were going to launch at the end of this month. Anyway, we do have a lot of we have short of 100 members and are trying to figure out how to use volunteers, but just with the concern that we don't really want to be putting anybody at risk. So therefore, we're doing calls to all of our members. And then when we come across members who don't have family members or don't have computers, to help navigate kind of the online ordering of things. If that's not an option, how are people helping their members? Is my question.
Anybody have an answer? You can unmute yourself if you want. Anybody have ideas for Amherst? So a lot of folks, it really goes back to answer your question, it goes back to my old village, and I can only use them as an example. The less than 50% of our members are on the internet, and they depend solely on the snail mail and different things. It's an older, much older population. I think the average age of my old village is 83. And so it requires just a little bit more hand-holding and interpersonal relationship, or, you know, conversations. And the phone tree is pivotal. What the outcomes of the phone tree were, if you want weekly groceries, this is the volunteer who's coordinating it, and call her weekly with your grocery list, and she's got a cadre of volunteers that are doing it. If you would like a daily call, this is our gal who's, you know, the caring committee, and she's organizing a member-to-member daily, you know, hello, how are you interaction. And as far as social programs, you know, our village is lost because they can't get people together, so they're depending on that phone tree to really communicate and keep in touch with our members on a daily or weekly basis. And it seems to be working, and the members are very appreciative.
I have something to add.
No.
Okay, Sandy.
Which one?
I just wanted to say, in Delaware, we're just starting, because we do have volunteers that are available to do grocery shopping, and we're thinking, we're getting ready to do like a care package for our seniors that will drop off with. We haven't really quite decided what's in it yet, but our community is making face masks. They're making face masks. And so we thought we'd put one in, but also some other stuff that just shows that we care. And, you know, we're also with the phone tree. And the other thing is that we're going to increase our monthly newsletter to either weekly or every other week again, having a volunteer drop it off physically. So, not to greet the person, but to slip it under their door, or whatever way we decide, so we can connect with them. And that'll have some news from the outside. It'll have some games, things like that.
Yeah. So to answer, can you hear me? I'm sure I'm doing this right.
Yes, Sandy, go ahead.
Okay. So I am in Sun City in near Hilton Head, South Carolina. And we've done a couple of things on the grocery store. One is we did our research on 3 stores, Walmart, for us, Kroger, and Publix, and the cost. And so for people that we normally transport for grocery stores, we are talking to them, first asking the question, are they computer savvy? And if they are, we help talk them through which one might be the best choice for them. If they are not, we talk to them about family or friends, because everyone has to enter a credit card, to set that up, Instacart up. If they are comfortable, and for them to know that that the family or friend can be anywhere, that they don't have to be nearby, which is always sort of surprising for them on that. And so most people have gone that route with family and friends, but we also made a decision that if someone simply has no one that they feel that they can trust, there are 4 of us who are trained to set up to be shoppers. And if the individual is comfortable with us setting that up and doing the credit card, we are willing to do that if there is no other option for them at this point in time. It's, obviously we're assuring them that we're not keeping the credit card on file. It's going into the grocery store system. And we've had 1 person so far that has had an interest in doing that. She just is just alone and doesn't have anyone with it. And the other thing that we are doing, we do reassuring calls. So we're continuing those reassuring calls to key members. We have about 560 members, and there's probably 30 of them that are that we do reassuring calls for. But we're also offering a check-in call, and I came on this late. You guys may already have been talking through this. But we're also offering check-in calls for anybody who would just like that, and not being official signing up, that we would normally do with. We're just tracking them and calling them as needed. We have a handful of appointments that volunteers had filled for this week, and then beyond this week, we are not doing any sort of transportation services to anything. And most of our folks have been super about that, but we've had a couple that have been very unhappy with us about that. With it. So that's, we're just trying to keep the communication open and checking in with people. And I'm not sure, and problem solving. Our phone lines are staying open, but we're getting very few calls these days. I think we've gotten 3 so far today. But as the time wears on, who knows what it's going to be like.
And I think that's one of the things that we need to look at is they may not be calling us, but they need a reassuring voice to call them. And it may be just, a phone call a week, but it's enough to say, how are you doing? Are you needing anything? And again, we have a lot of members that have family that may be close by, but we have a lot of members that don't have any family. And so that call really is important to them, and it opens up the line of communication. And it does alleviate the fear and the anxiety of the unknown right now. So, Seal. Can you unmute, Seal? Your hand's up. Seal Garrett, come on down. Okay. Then we're going to go to Carrie Sepcott.
Hi, so I'm at Villages OKC, and something that we've started doing is we have 8 volunteers, and we're dividing out a list, and everyone's calling one. We're trying to have a member talk to a member, and I've set up a little tutorial page because we're trying to get all of our members on Zoom, and what I've had to do is I've sent them out a step-by-step tutorial with pictures and screenshots. And I've had Zoom open from 9 a.m. to 4 p.m. every day. I did it Wednesday, Thursday, Friday, and then again today, so we can get them all set up and going. And then Wednesday we'll have our first Zoom meeting. But having these special little, I guess, training sessions has helped them greatly. And just the amount of times people have said, I don't think I can ever do this. And then we're getting them set up. So if anything, we're giving our members just a confidence boost that they can get on and they can work their computers if they need to.
The only thing I would suggest, I love that idea. The only thing I would suggest is Zoom is so overloaded right now to designate specific times. Don't open it up the whole, day.
Okay.
Because Zoom is going to, I hope, knock on wood, not crash, but they are totally overwhelmed. So dedicating an hour of, that, trial time, or let's test it out, is a great idea. But let's be prudent stewards of this too.
Okay.
Seal. Still not on us. You say you're on, I see you undone. Okay, we'll get back to Seal. Jane says, if a volunteer needs to help a member with an online order and the member does not have a credit card or not willing to share it, we're offering to the volunteer that we would reimburse the volunteer if they ordered with their own credit cards. And I think that's that's a really good way of handling it. If the volunteer is willing to do that, it actually negates that interaction of person to person and contact. The other thing is, again, I'm going to go back to my old village. There's a group of realtors who are not working right now, and they want to give back to the community. And there are a lot of folks out there that have secondary businesses and they care about their community, but they're not vetted. So that's why I mentioned, if you want to vet volunteers, you can go through some of the volunteer portal, the network providers. But if you want to have outside volunteers help, just don't include any money transactions. Tell the member or tell the volunteer, if you put it on their credit card, the village will reimburse you, or the member will send you a check, or whatever the case may be. And it's a great way to do it. That's why I mentioned the Harris Teeter, because they take that out of the equation. You can actually register, put your credit card online as the member, and then all you have to do is tell the volunteer, or you can order your groceries and the volunteer goes and picks it up. It's a great way to not have to deal with money interaction. And it's probably a really good segue to talk to you all about the scams that are out there right now. And unfortunately, our seniors are always target for scams, but now we have it more and more. And so we want to be prudent in your newsletters and on your social media content and talking to your members that now more than ever, don't ever give your credit card over the phone if they say they're, calling from Walmart or, Amazon, and they're going to take your order and they can ship it, overnight. Tell them not to give any personal information or credit card or any money. Scammers are alive and well, and they are targeting our seniors even more so during this crisis. So keep that in mind. What else? Marilyn Olson has a question.
Hello, can you hear me?
Yep.
This is an idea that we are trying out, too early to know, but we are using it to get new members who before may have said, I'm not ready yet, or I'm not sure I'm interested. But now that they are also sequestered, are interested in being of help to someone else. So we're offering a 60-day membership. We've done a press release, and we're doing Facebook posts and getting the word out through our current members as well as through churches and so forth. So we'll see. We think there are a number of people who would like to do something for someone else, but this way we can go through the normal vetting process. We do a background check, of course, and the application, but it's just for the 60 days. We're excited about the opportunity, so we'll see.
Marilyn, you're not the only one. I've heard from several villages that have put things on Nextdoor, and not just villages, but people on Nextdoor saying, I live in your community, I'm happy to help and get you groceries or do whatever. These are great potential members or volunteers, and other villages who are doing the same thing. They're doing a 2-month, type of membership just to help them through the hurdle. And chances are they'll remember it.
Barbara, we're calling ours a 60-day for $60. And that pays for all the Zoom classes and all the Zoom training that we already have available. So they'll be immediately in the network, as well as being able to make masks or anything else that they choose to do.
That's awesome. So Marcia asks, does anyone have experience using Google Hangouts as a video conferencing option? Personally, I don't. So I'd be curious if anybody wants to unmute themselves if they're using it. This is part of the G Suite. Anybody? No?
This is Iris, and we got set up with Google Suite for our board functions, and we actually use the Hangout Meet feature as part of our Google Suite portfolio of functions, and it worked pretty well. It's quite a bit simpler than Zoom. It doesn't have all the bells and whistles, but Google is set up to share documents and share screens and do some of those functions, as well as get everybody onto the same online chat room. So it worked pretty well for our board meeting.
Yeah, Jay Frankie said that Google Hangouts works very well, very similar to Zoom. So thank you. And Tessa from Union County Neighbor said they use Google Duo for board and staff meetings. So a lot of folks are out there utilizing that, you know, these different platforms to socially connect. Trying to think, we have a few minutes left. Let me see if I've missed any. Anybody else have? Dorothy, did you have another question?
Yeah, I just had a follow-up. You mentioned, Barbara, about one platform that you're using for groceries where credit cards wasn't an issue. What was that one? Did I misunderstand that?
That was Harris Teeter has rolled out something, a new, and you have to go into their link. They're the ones that are dedicating 9 to 2 every Thursday for seniors. And if you have a Harris Teeter near you, I don't have one near me, so I can't do it. But they're throughout the country. I'm assuming, just like any industry, other ones will follow suit and try to do the same thing to alleviate, you know, or help, you know, volunteers, you know, get in there, get the groceries, or, you know, the seniors to get groceries and make it easy, more user friendly. So I think you're going to see more grocery store chains doing the same thing, similar things. Jane asked, if a member needs to help a member with an online order and the member does not have a credit card or not willing to share it, we're offering to the volunteer that they would reimburse. Oh, I already said that, which is great. Thanks, Jane. So Village in the Heights said, we don't want to place that on the volunteer. Instead, we use the village's credit card if necessary. If you have that access, that would be great. If you have a credit card that the village uses. Lisa said to everyone, thank you for all the suggestions to call the insurance company agents with the drivers, you know, the driving members. She just did, and she said, yes, each needs to contact their agent, but based on my conversation, each claim is, of course, handled separately and may not cover the spread of the virus given the pandemic situation. He also suggested that villages be considered an essential business as we provide some services that are not provided by others during this period. And, you know, this essential business comes back to some of the support services nonprofits have, whether it's the homeless and, you know, some of the nonprofits, social services that are helping, you know, younger, think of all the kids that, you know, are not getting their meals at school, you know, and you know, that they depend on when they go to school every day. So again, I don't know if we have any attorneys on here, but, you know, are we considered an essential business? And what is the definition? That's a really good question, and I'm writing it down as we speak. to look and see whether or not, as a, you know, an arm of sort of a social services, are we an essential, you know, business? And I would think we are. But again, you all need to just call your own individual agents and find out, because I think that would be the prudent way to go. But thank you, Lisa. I appreciate it. Kathy Boyd said she tried with a small group this weekend, but a Mac user could not connect due to the firewall issues. I'm assuming this was with Google. Kathy, you want to explain? Can you get off mute? Oh, it was with Google Suites. So they had to give up and now they're going with Zoom.
Yes, I am here, Barbara.
Okay.
Can you hear me? And yes, it was with Google Hangout. Sorry, I didn't put that at the beginning, but we had tried with several people and we kept hitting these walls where either there was a firewall issue, it wanted you to download something else, or have a Gmail account, which was not my understanding you needed to have. So we just gave up and decided that we're going to go with Zoom for some of our small meetings. So.
Okay, great. And Jay also mentioned, you know, places like Home Depot, if they remain open, then villages should be considered essential. And I guess because you still have, you know, not essential businesses or construction, outside workers, things like that. So you still have business as usual, you know, with, you know, needing construction materials and different things. And even in the home, you know, if you had a leak or you needed supplies for something or another, you need the hardware stores. So it's an interesting question. Abby Simmons, the determination who is essential is being determined state by state. Yeah, thank you, Abby. I mentioned that earlier. It is true. At this point, our federal government has not taken the lead. You know, we as nonprofits need to put pressure on our federal workers or officials and tell them how important it is for them to pass, you know, this legislation, but more importantly, to look at the nonprofits as a way that they're going to need help moving forward and to get, you know, be the advocate for the universal, you know, donations and I'm trying to think of the word, the language. Universal, I wrote it down yesterday because they are playing a big part of it. Does anybody else know what I'm talking about? I don't have it in front of me. But, you know, a lot of these monies, you know, oh, universal charitable deductions. So this is something that, you know, they're debating on Capitol Hill and how they're helping nonprofits. And they did away with that a long time ago or a couple of years ago. So Jane said, we found that some of our volunteers who were told no in-person services were still planning to do it. Also, some of who we thought were going to make check-in calls hadn't done them or did them once and thought that was all as necessary despite our instructions. You know, we all are experiencing difficulties. I know that a village got back to me about, you know, a member who was insistent on going on a, you know, to their dentist appointment because it's her annual cleaning and she needed to go and that's what the village was for. And, you know, we've got a group of seniors that are very resistant to this whole thing. They don't want to, you know, they are the vulnerable ones. They are the ones over, they say 60. I take exception to that since I'm 60. I don't think I'm vulnerable. But I do think the 80-year-olds are definitely in that, you know, and we have a lot of them. We have to protect them. And it's our job to not make our members scared, but also to reinforce, you know, that we're there for them and to help them. And everybody's in this together. And whether or not we have a universal village, everybody go outside and clap their hands like the Italians were all singing or whatever. we need to do it as a village, as a network, you know, set aside a time and everybody go outside and, you know, clap their hands for all the healthcare professionals that are out there on doing our job, you know, doing their jobs for us. So Douglas Gaddis did actually post for Maryland Village the legal guidance for the state requiring today's closures. I will tell you, I'm not going to go into it, but I will tell you that everything that all these chats and everything, Travis will capture and post afterwards on our YouTube. So you can rest assured as the questions and the commentary as we're going along. And Mondays are not great for me because I talk in circles sometimes because I'm not awake yet. But another question, so thank you, Douglas, for doing that outline. Tony, at Conejo Valley Village, about 30% of our members don't use computers, but we have them call into our Zoom meetings on their phones, which is great. And Marcia said, light a candle and keep it lit. Well, not when you're asleep, but definitely light that candle. Let's show some solidarity as we can. I continue to say, be proactive, not reactive. Look at this as a not a threat, but an opportunity for our village to show leadership and take care of our community at large. And I think that's what we're showing, what we've shown all along. And Erico Kennedy said, if you have a resistant member who doesn't understand and insists on asking for a ride for a superfluous errand, take the request and let them know that no volunteer signed up for the gig, then offer an alternative possible. And I think that's what we're finding is, you know, that you have to really offer alternatives and be really firm, because they're looking for you to guidance. So one last one, and then I think we're going to have to end up. Also, Jane said, also, just because someone has home care or home health care services does not mean that they are socially connected, especially as home care persons may not be tech savvy. I worry that the home care staff are bringing in the virus. They are not only practicing universal, they're only practicing universal precautions, if that, and can't do social distancing. I think the one thing I will tell you is, in talking to a home health company, they are requiring that their aides to take their temperatures, that they are mandating, you know, intervals of check-in with their aides, that they are, just like nursing staff, you know, they're under guidelines within their own licensing. But I do agree with you, just because somebody has a home health care worker in there, that doesn't mean that that senior is being entertained or socially engaged. So it's even more of a reason to, you know, keep in contact with that senior or that member. And also, you know, we're all talking about technology and everything, but the good old pick up the phone and just call somebody works, and has for years. And so we have to go back on that a little bit too. With that, I'm going to close it up. I thank you all. As I said, we will be posting all of this, you know, downloading the YouTube, and we'll post it on our Facebook and send it out. We do appreciate all your support. Look for, oh, we have a couple announcements. We will have a great webinar next Monday, Flex Together. It's an online exercise class. And they were at our conference last year. They're going to do a Zoom conference call to show you their program. I will ask you that only one member of your village, please, jump on that call, because we've had a lot of interest, and we want to make sure everybody gets the ability to jump on if they want to. And like I said, we'll let you all know about CVS. They are going to be coming on. Omnicare is very interested in talking about how they want to work with villages. So look for that posting. We're just back and forth with times and whatnot. So I appreciate all. Stay well and healthy, and don't socialize. Thank you all.